Hello, my name is Baylor Manier, and today I'm going to be discussing with you the topic of tennis elbow, or otherwise known as epicondylitis. My goals for this video are to discuss with you what epicondylitis is, go over different ways to treat it and how it's caused, and then finally discuss with you the stretching routine that I've created for my patient in a physical therapy setting. Tennis elbow, or epicondylitis, is a type of tendinitis, swelling of the tendons that causes pain in the elbow and the arm. More specifically for tennis elbow, it is located in the tendon that connects your extensor muscles to the knob or that rigid bone that protrudes from your elbow. These tendons are bands of tough tissue that connect your muscles to your lower part of your arm in the bone. Despite its name, you can still get tennis elbow even if you've never stepped on a tennis court or been anywhere near one. Instead, any repetitive gripping activities, especially if they include the thumb and the first two fingers, the pointer finger and the middle finger, it can contribute to the formation of tennis elbow. It usually develops over a time, repetitive motions like gripping a racket during a swing. These types of activities can strain the muscles and put too much stress on the tendons. That constant tugging can eventually cause microscopic tears, which is known as tendinitis or epicondylitis in this case. Tennis elbow might result from playing tennis, racquetball, squash, fencing, or even weightlifting. There are many other activities that can cause tennis elbow, but these are just a few to name off. There are 3 different grades of tennis elbow. Grade 1 epicondylitis is the mildest form of this condition, and it's characterized by the feeling of general achiness in the either lateral or medial elbow. Lateral tends to be more on the tennis side, while medial is correlated with a golfer's swing, just because of the different muscles that are used with those swings. And with grade 1, the feeling of pain is going to occur during the activity, and it's going to slowly disappear once the activity is stopped. If a correction to the activities is not made, then the condition will progress to a grade 2. Grade 2 includes pain becoming more pinpoint, so you'll be able to identify exactly where the pain is coming from, whether that be the medial side or the lateral side. And a second ago, I mentioned something about preventing the progression from grade 1 to grade 2. This can be done simply by changing up your routine, performing different exercises when you're weightlifting, making sure your form is correct when you're holding the racket, different things like that. It can also include providing yourself more rest time between activity periods. But if you do end up going into grade 2, as I said, the pain's going to become much more pinpoint. You're going to be able to tell roughly exactly where it is. This is due to edema, which is the fluid is going to build up in that area. There's not going to be as much blood flow in that area, and that's where you're going to see inflammation and tenderness in those tendons and muscles. And as tennis elbow progresses to grade 2, there's a chance that you might start feeling tingling or numbness in the index fingers as well as possibly the thumb. And this is a big problem, as it might lead to grade 3, which can lead to potential surgery. Grade 3 epicondylitis, if you're suffering from this, the condition, the pain, the swelling, and the tissue damage are now causing weakness that is interfering with your day-to-day activities. And I've actually talked with some people who have had some form of tennis elbow, whether that be grade 1 or grade 3, and they've mentioned that at any level, there are certain tasks that you're going to feel pain with regardless, especially at grade 3. The patients that I've spoken to with grade 3, they say that activities as simple as turning a door handle or lifting plates out of the dishwasher and even writing a paper become extremely difficult, because you're going to feel a sharp pain coursing up through your elbow or your forearm into your elbow. And with this, you're going to have involuntary compensating for this pain by using the shoulder, the neck, and the thorax rather than your elbow when performing these activities. And that's going to give you bad form, and it's going to lead to other issues past tennis elbow. So now moving on to the next portion, the symptoms. I know I've gone a little bit into detail about the different symptoms for the specific grade of the injury, but overall it is important to know the general symptoms of tennis elbow, which include pain and tenderness in the bony knob area of the outside of your elbow. This is where the injury is most commonly found, as it's where the extensor muscles are connected to the bone by the tendons. The pain may also radiate into the upper and lower arm, and even though the pain and the damage being done is in the elbow, you're likely to hurt even doing things with your hands. So now that you understand a little bit about the symptoms of epicondylitis, we're going to move on to my patient that came to me. His name is Kyle Smith. He came to me with a chief complaint that there was a sharp pain on the outer part of his elbow, and it's been bothering him for a while. Upon examination, he was able to pinpoint exactly where the pain was, or at least the area, and it was near the epicondyle on the lateral side of his elbow. It's the protrusion where those tendons connect for the extensor muscles. And as I was feeling around, I could tell that he was extremely tender within the muscles and the tendons of that area, and there was extreme inflammation of the area as well. After I examined him, I assessed him with grade 2 lateral epicondylitis, or otherwise known as tennis elbow, and the plan for him is a routine of stretches that I have hand-selected. They'll be performed so that he may hopefully have a full recovery and prevent any further injury, provided that all the stretches are completed at home and within the office. So here are the list of the stretches that I've given him. There is only 5. This is because the tendons of the muscle are so sensitive, especially with tennis elbow, you don't want to overwork them at first. As we work into strengthening the muscle and getting the tendon back to its full health, I will add more stretches and more activities that he can perform so that we can prevent further injury. But starting off, the ice cup massage, this is what you see right down here in the left-hand corner. Basically, what this is you will freeze water in a Dixie cup up to about 3/4 of the way, and then after it's frozen completely solid, take it out of the freezer, and you're going to rip off the top portion of the cup so that you can just simply move the ice around the affected area. And what I'm going to have him do is just take the ice and massage the area around the outside of the elbow until it's red and it goes numb. For the first few minutes, it's going to feel hot, it's going to burn, and it's going to feel uncomfortable. But after that first couple minutes, it's eventually going to go numb, turn red, and it's going to start feeling a lot better. The next exercise is a flat table fist squeeze. I know that sounds a little weird, but it's actually what the gentleman up here in the top picture is performing. You aren't going to be performing this with weight as shown in the picture, because it would just increase the stress that's being put on the tendon, and that's not what we need for a quick recovery. You're just going to place your arm flat on the table, and you're going to slightly raise your hand and form a fist. You're going to contract your hand into a fist, and then you're going to relax. Contract, relax. And it's also important that you don't do this too fast, because you don't want to pull or strain any of your muscles or tendons further, as they're already weak. The next exercise that I've included is actually another massage. It's called the cross-fiber massage, and what this is the fibers of the muscles and the tendons in the arm, they run lengthwise of the arm. So what you're going to do is you need to take your pointer finger and your middle finger and place them on the area, the tendon that is hurting. And what you're going to do is you're going to move your fingers across, massaging them in a horizontal pattern, so perpendicular to the fibers. And what this is going to do is that because your tendons are under so much stress, they're going to be tighter than normal. This is going to break up those tendons, and it's going to allow for better circulation, better blood flow, and it's going to get that nutrients to those muscles and those tendons, and it's going to allow for a quicker recovery. After that last massage, you're going to move into what's known as a forearm drop, and this is a very simple exercise to do. It doesn't require much at all. You only need to know how to perform a bicep curl. And you're not going to be using any weight with this activity. Essentially what you're going to do is you're going to start with your palm facing upwards with your arm at a 90-degree angle, and you're going to move your palm, the palm of your hand, to your shoulder. This will be your bicep curl. And at the top, you want to contract your fingers as well, so that you're making a fist. When you're at this stage of this exercise, you're going to relax all the muscles in your arm at once and just allow your arm to drop. This is a great exercise because it provides instant relief as you're contracting all the muscles and the tendons together, and then you get instant relief as soon as you're relaxing them. This should be performed 10 to 15 times on the arm that is affected, and you should not feel any discomfort or pain with this exercise. If you do, it would be best to stop, and then I will be more than willing to create a new exercise or provide you with a new exercise that provides the same relief. The last and final exercise that I have provided is the palms down wrist curl with a stretching band. Now, I've decided to use a stretching band rather than a weighted wrist curl because you can change the level of tension that you're putting on your tendons. If you would like more tension, you just shorten the length of the band or where you're grabbing the band. If you want less tension, you just allow more slack in that band. This is great because if you're at different levels of recovery, you can change how much tension that you have within that band, and it's really great. You can use this all the way through your recovery, and it's honestly a really great activity to perform after you've recovered because it will help it'll keep those tendons and the muscles strong, and it will prevent future injury. And this is going to conclude my presentation. I will note that it's important to complete all the exercises that you are given when going through physical therapy, and it's important to complete them to the best of your ability because that's going to give you the best recovery overall. And thank you for joining me on my presentation, and see ya.